Ozzy, man.
Thank you so much for everything. You helped me a lot.
Man, I'm so happy,
You
man.
know, before the fight, I was. Like,
I remember, man. You could barely move, man.
Yeah.
Man, it was insane how well you performed with everything. Dude, I can't believe it.
I can't believe it.
Yeah, now we could actually do more peak performance stuff using some of this technology we got.
100%.
Man, I'm excited. I'm really excited. You remember when we first, before that fight, when you came to me, you could barely move your head. The chest was so pulled forward you couldn't even move. Remember, I used the shockwave and I broke up all that tissue. Then we did that active release and stretched it. But you're still having the muscles connecting to the shoulder blade really tight because your range of motion is still kind of limited.
Yeah.
So I'm gonna work on these muscles here, and then I'm gonna come back and I'm gonna work on the chest again. And it was really cool that you just told me that afterwards you got more power.
I got more speed and I feel like free, you know.
We're doing axial spinal decompression. So I just finished programming the machine. Now we're going to set him up. Perfect. So this is going to open up the vertebra with an axial spinal decompression. So it's a traction machine that pulls and releases. I'm going to be using a Neuromed electroanalgesic therapy. This is actually technology that's going to help basically on an algorithmic program to help with the nerves. Alright, so this is going to run for 10 different program settings, and each one is going to change the frequency to try to help with the nerve impingement. And this program specifically is for nerves. All right, we're using a diode 810 nanometer laser, basically to get photostimulation or photomodulation. I want to get down to a cellular level and stimulate more energy for the healing cycle, to reduce inflammation and decrease pain and increase range of motion. We're doing pulse electromagnetic field therapy. The first thing I like to do is ground the patient. So right now the mattress itself is connected, and the mat is connected, and as you can see, the patient is literally hugging it. Look at the pulsations into his whole body. So right now we're grounding onto a similar electromagnetic field to Earth, and after we do this particular method, I then will localize it to wherever he has pain, utilizing that particular pads, which is going to go around the pain. Now this is photostimulation utilizing near infrared light in a red light bed. And Azimut's going to be getting in there in just a second and getting 12 minutes of therapy. And he's going to feel amazing afterwards. Increased performance, reduced inflammation, overall wellness.